Welcome back to Base Sunday. Do you suffer from migraines? You got body aches, anxiety, low energy, sex drive, need a bit of a jolt? Well, the doctor is in this morning. Our next guest, Dr. Maud Nerman. She is a gifted healer practicing osteopathic medicine over the last 3+ decades, and her patients are all the better for it. And now you can get healthy at home with her new book, Healing Pain and Injury. Easy reading and brimming with practical ways to ease the pain. Pleased to welcome Dr. Maud Nerman. How are you?
Very good. Thank you, sir.
Good to have you here. Good to have you here. Osteopathic.
Osteopathic medicine was invented by this amazing Civil War physician. He was an MD, and it seems that he trained a little bit with the Native Americans to learn some manual medicine techniques. He then perfected these, which had an amazing effect during the 1918 flu. The people who saw an osteopathic physician tended not to die, whereas the other people, there was a 25 to 40% mortality rate from pneumonia. We've come a long way. We prescribe drugs, we do surgery, but we have that little extra that we understand the anatomy and physiology of the body even better, and we know how important it is to restore motion to areas that have been jammed. We also have this amazing ability to feel the brain. The brain expands and contracts just like the heart. We figured this out in 1920, but it was only the technology in the 1980s that then could document that. They saw that when they opened the skull, and during brain surgery, I don't want to be too risque here, but they thought that was the heartbeat, but it actually has its own rhythm.
Oh, wow.
And we've been working with the bones of the skull to restore motion to the brain and to the skull. So when there's a head injury or a brain injury, a lot of the time the problem is there. And so we've been working to fix that.
This is your life passion because as a child, you suffered from severe asthma. And tell us kind of how you got into this in the first place.
I was very sick from the age of 3 to 6, maybe a little longer. The drugs that saved my life, thank God they did, they also made my heart race and they filled me with panic. I think it's somewhat like speed, which I've never wanted to take. But I had to learn how to calm down, sort of like this last gentleman talking with meditation, to calm myself down. And I was lucky. I got healthy in my 20s, so I wanted to help the other people who knew what physical suffering was like, because I now know there's so much we can do to help pain and injury.
Talk about what you do, because people come to you with chronic pain. They may have seen an internist or another doctor who may prescribe some sort of drug, and it didn't work. What do you do?
Well, partly the body has this amazing self-healing ability. And one of the things we as osteopathic professionals do is we help amplify that ability. And we help the motion of the skull move. We help when things are jammed. And also I feel like after an injury, something happens that I've named injury shock. And when you can put your hands on someone, you feel the nervous system trembling. And this can go on for 20 years after a small injury. When it's really severe, that becomes post-traumatic stress disorder. So there are 3 components to injury and pain that's almost always there when people are in pain. And if you address them, all sorts of pain will wash away. There's injury shock I talked about, inflammation. There's all sorts of things we as practitioners can do for inflammation, but there's piles of things patients can do for themselves. And that's in the book as well. So I talk about some of the things I offer, but more I talk about what there is for patients so that they can take care of their own healing.
Part of it's diet too, right?
A lot of is diet for inflammation. And I'm not a dictocrat because everybody needs a little bit differently. Some people can get away with their soda. Other people really can't because there's not such a healthy thing. And it's especially important after brain injury. The military has learned that you need high doses of protein after the brain injury. This just came out about a week ago. And you also need healthy fats like coconut oil and fish oil. And it's very important to get the good stuff into the body and the bad stuff out, which is why we're also so effective with brain injury, because we help move the pipes that get the bad stuff out of injury.
We got to take care of ourselves. How about sleep? Because that's something I don't get a lot of. That's not a good thing, I understand, after reading your book.
Right, I have a little picture. I say worship sleep because of all the things you can do. It's really the most important. The body heals during sleep. The brain heals during sleep. It's absolutely essential. So I really, it's something people have control over. I talk in the book about how to develop habits so that you go to bed at the same time. And if you don't, maybe your afternoon nap, even a 20-minute nap can be amazing.
It does make a difference. Lastly, give us an example of someone that came into you with chronic pain, couldn't get it fixed anywhere, and you were able to help them out.
I saw a young woman, she was about 14, she was deaf in one ear. and she had terrible headaches, just excruciating headaches. And the medicine they put her on, her heart was beating like crazy. They thought that she would have a heart attack. Her cardiologist sent her to me. She drove 3.5 hours. Her mother had a spreadsheet of all the drugs she's taken. I said, "Did you have a head injury?" She said, "No." She lay down on the table. I put my hands on her, and her head felt like it had been welded together. And I said, "You've had a head injury?" And she said, "Yeah, this started when I fell backwards and hit my head on the curb. And it closed down her temporal bones where the ears are. And it locked the inflammation of an ear infection in, which is why she went deaf."
Oh, wow.
And after 3 visits and a homeopathic remedy, she never had any more pain.
And you've got a lot of those in here, right?
I have
Whatever
lots of
ails
stores.
you?
Whatever ails you.
That's great. That's great. Well, we wish you all the best. Thanks for coming in.
Thank you very much
Doctor,
for having me.
We appreciate it. If you'd like more information about healing pain and injury, log on to Dr. Maud. You see it there, MAUD.com. That's drmaud.com. And she's over in Corte Madera, right?
Correct.
Super. Back with more Base Sunday right after the break. Stay right there.